Hello everyone, welcome to our channel. In this video, I am going to explain about the cervical cancer. If the cancer originates in the cervix, we call them as cervical cancer. Cervix is the part, it is the neck of the uterus which connects the uterus and the vagina. Usually, the cervical cancer occurs because of human papilloma virus infection. And this cancer is most common type of cancer in women, and it is most common in the age group greater than 50 years of age. Usually the cervical cancer is most commonly seen in people with immunocompromised women, people with HIV, diabetes, high sugar levels, smoking, vitamin deficiencies, and a family history of cervical cancer, people who are giving birth at very young age, and women with multiple sexual partners. They have high risk of getting cervical cancer. People with cervical cancer have symptoms of abnormal vaginal bleeding. This abnormal vaginal bleeding is seen immediately after intercourse, and during menstruation there is abnormal menstrual bleeding, there is vaginal discomfort, and there is also discharge from the vagina. This discharge is usually in the initial stages. This vaginal discharge is watery, and in the later stages they become red or brown discharges seen, and it is very unpleasant smell will be there, and there also pain will be seen while urinating, and there will be blood in the urine, constipation, and most common and most important symptom is there will be low back pain and pelvic pain will be seen in people with cervical cancer. Along with these symptoms, there may be unexplained weight loss, fatigue, leg swelling. These all symptoms can be seen in cervical cancer. And there are various stages of cervical cancer. If the cancer is confined to cervix, it is stage 1. If there is cancer spreads beyond the uterus and it spreads up to upper two-thirds of the vagina, we categorize as stage 2. In stage 3, the cancer will be in the cervix, uterus, vagina, and also it involves the kidneys or ureter. Whereas in the stage 4, the cancer is metastatic. It spreads or invades into the adjacent organs like bladder, rectum, etc. We call this as stage 4. Coming to the diagnosis, cervical cancer can be diagnosed by pap smear for human papilloma virus. Pap smear and other tests like colposcopy is used for the screening of cervical cancer. Treatment is usually depends upon the staging, at what stage the cervical cancer is there. In the initial stages, we can remove the cancerous zone of cervix. We call them as conization or hysterectomy, where the uterus is removed. In the severe stages, there will be chemotherapy, radiotherapy, etc. Coming to the prevention, we can prevent the cervical cancer by regular cervical screening and by taking HPV vaccine. HPV vaccine is usually taken if the children is 9 to 14 years of age. 2 doses of vaccine should be taken. First dose after 6 months of first dose, second dose is taken. Coming to the people who are women greater than 15 years of age, 3 doses of HPV vaccine should be taken. First dose, and then immediate next day second dose should be taken, and after 6 months third dose should be taken. And people who are pregnant or planning for pregnancy in the next 6 months, please consult the doctor before taking the HPV vaccine. Generally, the cervical cancer is people who have cervical cancer, they can consult the gynecologist or surgical oncologist. This is all about the cervical cancer. Hope you like the video. If you like the video, please share and subscribe our channel. Thank you.